I'll just go with the story so that, because there's bits that have come up, but I want to know what the story is. So the first place that I went to was teeth. Like I got sensations. Was it teeth? But then I got ear, but then I got cranials, and I also got the TMJ joint, which is this bit up here, when you do that, yeah? And it was just all along there, almost as though I was semi-deaf or something was happening on this area, but it was also linked to the ileocecal valve, which is right here. So your large bowel comes up and across and around here. It's in where the small bowel and the large bowel connect up together. Then in the large bowel, I also got slight diverticulitis. That's inflammation of the little hair follicles inside. Then in the pancreas, some anxiety. And then in the liver, she's quite deficient of B2 folic acid. That's really nice, but I want to know the story. Then lastly, just before I was going to finish, I got the lungs. Related to child, it was almost like asthma, suffocation, chest infection, something where I just felt like I couldn't breathe. But when I went into there, once I got to anxiety, she shut down. She didn't want me to know. It was like, does that make sense so far? She just said, that's fascinating. I don't know if it makes sense, but it's fascinating.
Yeah, absolutely.
Okay, so now we're going to go with the story of what's happening. Emotionally, large bowel is about obsessive and possessive. Obsessive and possessive is negative and positive. It's a fantastic thing. I'm really obsessive about my business and my family. And my brand new dog. I've had him for 3 months. Why am I obsessive? Because I love them, just love, love, love. I love my clients, so I'm obsessive. But the duality of obsessive can be OCD, it can be worrying and thinking. Does that make sense? So when I mention an emotion, there's duality to all emotions. So in this area, it was more obsessive-possessive. There's no such a thing as a negative, but just going over like a stuck record on things. Just think about it. Not yet, not yet. The lungs, grief, and reaction to something. And it started from the age of 5. But again, we want to find out more of the story. Liver, organising, planning, disempowered, impotence. It can be sexual, but in this case, it's feeling disempowered. Cranials, inside your cranial bones, where the suture lines are, that's where we hold past lives. But the cranial bones, it also protects the brain. Here, ears, not understanding, and then teeth, decisions. So I've got a whole whack of information, but now if I was doing a medical intuitive consult, I want to talk to the client and say, how are you going? What's happening? And then link up the story. Does that make sense so far? As I'm speaking, her liver's just going, wee, 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 wee. So we're going to start with the liver, and I'm going to ask questions appropriate to the liver of, how organised are you?
It's completely disorganised.
Yes, disorganised. All right. But she must have been organised somewhere. Come here, hon. Because she's looking beautiful, isn't she?
Yes.
You know, everything matches, and it's all lovely. So she's organised somewhere. All right, get back over there. Okay, so let's go to anxiety. Do you ever experience, I never say suffer, it's experience anxiety on some level?
Oh, yeah, all the time.
All the time. Are you experiencing it now?
Exactly. To some extent, a little bit,
Okay.
but yeah.
Okay, so to some extent she experienced it. When is the main times you experience anxiety?
When is the
Main time you experience anxiety?
when I don't know what's next, or if I don't have a plan.
That's the liver. Oh my God. When I don't know what's next, what's to plan. And what happens when I did autopsies, I noticed that if I was just to chop her in half, that side of the body mirrors that side, and this side of the body mirrors this side. And again, when we look in the medical system, we might be looking at the right shoulder, but the opposite is actually the left hip, and they're looking in the wrong area. Not their fault, it's just not an awareness. So here we've got mirror image of something, of which one came first, the chicken or the egg, or the pancreas and the liver. So we've got to find out more of the story. So, tell me about teeth. ear things. What's happening there?
See, that's fascinating because,
Come over here, Di.
yeah, but I don't really still understand, but I know, yeah, I know my teeth tell me a lot. What are you telling? My,
That's okay, I'm Greek. Au revoir.
You've got lovely teeth.
thank you. Yeah, my teeth seems to tell me when to stop doing things. When it's eating, when it's in a place I just get a pain here. I get a pain right in this jaw and it just tells me to stop and I know and I don't know why and I don't understand it. Don't understand it.
Yes.
Oh my God.
Yes. Very good. Thank you, my darling. So she's spot on. We're going to take the TMJ though down to here. When I'm not doing something, when I get anxiety, don't know how to organise it, and I don't understand, my teeth will play up, hurt, indicate whatever the word is. And then it's related probably to something that she's obsessive or possessive about. Does that make sense? Does that make sense? Kind of. So what will happen now is her brain will go, oh, Jean, you're getting too close to the story. Where it goes so close. So let's go back to when you were 5 years old. I've just sidetracked so that she gets away from there.
What was that? Perception. Okay.
Say it again.
Oh, it's a perception. I'm trying to think when I was 5. I
Yeah.
had to put it into my,
Yeah. What were you doing at 5 years old?
I was in reception, like at school, but I'm trying to think when I was.
In reception. What does that mean?
So grades at school, it's like the one before grade 1.
Okay. So she's preschool before grade 1.
Yeah.
Yep. Yep.
Yeah. Yeah, that was probably, see, that's bizarre because I don't remember too much of that.
That's okay. She said she doesn't remember. What if? And I always say what if because they need to self-realise. What if, starting school, how much do you know what's going to happen at school? None. Your whole control is taken over. I'm the teacher. Does that make sense? So in comes maybe a little bit of anxiety, which children don't show anxiety as such. They suppress it, can't organise, I don't understand what's going on. Oh my gosh, I'm going to obsess on what's next, what's next. What if? And then what if the story then continues that every time she cannot control a situation, she goes into a little bit of anxiety. What if? And she's just, you can see her whole body and brain is just contemplating,
Yeah, I'm like,
scratching, working it out. So what, yep.
yeah, I started swimming at the age of 5 because I was a big swimmer. And that's interesting with lungs as well because I suffered a lot of sinusitis and tonsillitis.
So can you all hear her?
Yeah.
Yeah, with all the like the crack in the pool, I guess. So yeah, that's interesting with lungs. I never knew that I had anything with lungs, but I know when I get anxiety, I don't breathe. Like I will forget to breathe, and naturally, I'm generally like, and then I have to stop and.
And what happens when you don't breathe? Clench up. And then clench up, everything in the body clenches up. So right down to even physical, and we're not going to ask her, physical constipation, emotional constipation, all of the, don't tell us, we don't need to know. So, what are you thinking?
I'm just thinking swimming days because, yeah, like swimming gave me a lot of anxiety, so I'm trying to think.
Okay, just stop. Just stop. Swimming gave her a lot of anxiety. What sort of things could be happening for a little 5-year-old in swimming?
Pressure.
Pressure? Who said that? Beautiful. What else?
Fear of drowning.
Fear of drowning. I want to go to the cranials. Like I said before, the cranials hold past life. So it could have been a past life or past lives connection as well. Do you like swimming now?
Yeah, generally when the water's nice, I do. When it's calm.
I don't quite believe her. Why?
Hesitation.
It was a bit like that. Oh yeah, when it's calm. So she even went to pancreas, anxiety, and liver. Yeah, when I really know what's happening and I'm in full control and the water's calm. And
So for a 5-year-old, competition takes all the joy out of it.
for a 5-year-old, competition takes all the joy out of it. Absolutely. What else? You guys are good.
Someone could have accidentally almost drowned her, like
Someone could have drowned her, sort of thing.
Yeah.
Yep. Yep.
She could have dragged in past life.
Yes, we had the past life stuff, something in past lives. Yes,
An expectation of other people.
could be expectations, could be parents,
Just not being able to breathe.
not being able to breathe. What made you say that?
Lungs.
Intuition?
Yes. Got it, intuition. If I went to all the bits here, even though she might have come to me re-anxiety and I've got pain in my teeth, I would have gone to lungs of not breathing in life. That I just can't go swimming in life like real flow, like my dress is all flowy. Watch the body stance. And that's where sometimes the physical, turn around honey, not good or bad, nothing's good or bad in medical intuition. It's like, it's tight, very tight. It's organised and it's planned. It's very liver.
When you dive underwater, you have to hold your breath.
You do have to hold your breath. How much are you breathing in life when you have to hold your breath? What are you thinking?
Hey? Oh no, it's just funny. It's really funny. Because it's so true.
So true. Okay. So we're going to wrap it up, and I thank you very much. I'm not going to go any further, but you can see me afterwards. How's that? That way it's not taking into the emotional aspect and having a healing process or anything else here on camera. Yeah. Very good. But I thank you. Please round of applause. One more time. This one's not as medical, it's more metaphysical. Who's this? Do you want to come up, darling? What's her name?
Julie.
Julie, come on up, darling. I never know in a medical intuitive session, come over here, honey, what will come up. It could be physical, emotional, spiritual, who knows, who knows. I got Mount, do you talk a lot? Do you want to talk a lot?
No.
No? Okay, why would talk a lot come up with with a quiet person?
Because she doesn't talk a lot.
Self-talk?
Good. Very good. What, is the self-talk really good? Like it stands there and it says, I'm so good?
No, I don't say I'm so good. Is that what you mean?
Yes. No, what sort of things would you say?
A lot of analytical stuff going
Yep.
on, yeah.
Yep.
A lot of internal dialogue.
Perfect. Anyone else do internal dialogue, blah, blah, blah in their head? Yeah, that's everybody. Okay, so then I also went, when I collected blood, just turn around this way, darling. When I collected blood here on people, I called it stabbing people, and I used to have Dracula teeth from a cosmetic thing, and I'd pull them out, and it was proper china things in, and I thought, this is what we hold in secrets. And so when I used to take your blood, I'm taking your inner secrets. I need to look under a microscope to see them. Does that make sense? Well, I don't need to, but Western medicine needs to look under a microscope. So in here was like, or there's some inner secrets, and I still want to go to talking a lot, talking. The mouth is about gullibility and taking information. And when children learn, like if you're all children watching me as a teacher, you'll all be listening like this. Ever notice that? Children learn with their mouth open. What do we say to children?
Shut your mouth.
Shut your mouth. Whereas really, that's how we take information in. So there's a lot of gullibility. And gullibility can go back to self-talk. How many of you, and I've been there as well, believe your own self-talk crap? Yeah? Okay. But linked to that was heart's desire is to speak. And speak lots and talk lots and talk lots and lots.
Very shy.
Very shy. She said she's very shy, but she came up here, didn't she?
She did. It took a lot of courage, I can say.
All right. Courage, C-O-U-R, Greek word, I'm Greek, means of heart. So because this is all about heart's desire. Her heart's desire is to speak. Now to speak doesn't mean going blah, blah, blah like I am. What else is a form of speaking?
Writing, poetry.
Writing, poetry. What else?
Singing.
Singing, what else? Art, that we said dance. Darts as well, art. Yeah, all the creative. And she said that she's quite analytical, and that's the left brain, which then shuts down the right brain. The left brain goes structure, form, structure, form, structure, form. The right brain wants to go like, wow, like, yeah, let's be in the moment. And then I also got the circulatory system, just general, didn't know where to draw it, and blood. Do you have any blood stuff? You have blood, but any blood problems? No, because what I got was life force. So what could be happening in the blood, do you think? Could be poor circulation. Do you have poor circulation? No, that's not on the list. Next,
Lack of oxygen.
could be lack of oxygen. Lack of oxygen is known as iron,
Anemia.
anemia. Yeah, beautiful. What was the other one?
So depleted just in all those minerals and vitamins to keep the blood really
Perfect. You guys are good. You are really, really good. Okay, how have you been feeling lately?
Not so great.
Yeah. and without divulging too much, what sort of things?
I've had some pain, sort of joint pain and stiffness.
It comes in the blood.
Yeah.
If I've got stiffness in the joints, what could that be?
Inflammation that's pooled and circulation's not working.
Yes. Very good. Very good. You guys are awesome, awesome, awesome. Okay, so I want to come back to gullibility, self-talk, but I need to speak. What would we say? You can join in too if something comes in.
You're making our blood unbearable by the thoughts we're thinking.
Yep, that could be one thing.
I would say look at diet and deficiencies. And
Very good. Very good. What else?
If I don't have the energy, I can't speak out and I can't show my gullibility.
To show her gullibility or vulnerability or all of those delicious words, that's pretty like
Swallowing your words.
swallowing words.
So
So what could I do for her?
I was just saying not speaking her truth.
Okay, I love that you said that because I don't know what it means. And the why I say that is I know in the awareness arena and spirituality, people will say not speaking truth. But if I was to yell, I'm not going to, but if I was to yell at her, she's my sister and I hate her, and I go, I hate you, you're a bitch, that's speaking my truth, isn't it? Does that make sense? But speaking my truth might be, I really love you, but in 5 minutes later, I hate you again, so I'm always speaking my truth, if that makes sense. So I love that, but what if her speaking her truth was that she was dogging on herself? But that really wasn't the truth. And if there's pain in I'm just going to borrow your body for a moment, darling. If there's pain in joints, what what happens is that the blood will pool and it will be quite acidic. So yes, we could look at nutrition, we could look at diet and all those sort of things, but I bet you it's more on the thought concept, like you said before. So I'm going to have to wrap it up. It goes really, really quick. And I thank you so much for coming. But the both of you, don't run away. Come and see me afterwards, please. Any last questions before yes?
I'm still got my mind on that gullible.
Yes.
You know, what that means in terms of what's the opposite of that?
What's the opposite
What
of
is it?
gullible?
What is it blocking? Yeah.
Oh, okay, so I'll just...
Two things, I guess.
Yeah, medical tuition, nothing ever blocks.
Okay.
And you are never ever stuck. So when
Oh.
I teach medical tuition, it's not about you're ever stuck or blocked. Because we can feel like I'm in a pool of mud and I've got 1 foot out but 1 foot stuck. Or if I'm stuck in the mud, I still can move in the mud. So I'm never really stuck. It's just I'm not ready to see another perspective, if that makes sense. So I like that. What was the other question? What is the opposite of gullibility?
Yeah.
I think being gullible is trusting others before you trust yourself.
Very much. Gullibility is trust others, but it's also believing, and this is my oldest son, trusting his monkey mind thoughts rather than what is actual, and I use the words, speaking truth. Does that make sense? So he will dog on himself and say, I'm really bad at blah, 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 and yet I rely on him for the IT world. Jamie, fix the computer, Jamie, fix the projector, Jamie, fix all of the IT stuff. Does that make sense? You guys are amazing. I'm going to have to wrap it up.